Hi, everyone. Thank you for waiting. I just got a little bit delayed here with the elected call. So we will jump into this here. Beautiful day out here on our Friday, May 22nd session here. So I don't have a whole lot, so hopefully you guys have some questions. Just an update, the 1783 we're at now is just plus 45, and it's to be expected as we expand testing now to throughout the county and certainly try to increase that those numbers. We had a couple of good days in Daly City. The first day, we had some growing pains, and I think yesterday they were able to do 400 tests. Today we're in East Palo Alto. I haven't had a report back on that yet, but we're accommodating some walk up, and we'll be able to sift people to register, and that is our goal. We do have one additional death to report from the last time we spoke, so we're at 76 now. As you can see, that the main group that remains the highest infected group is at the 30 to 49 age area, which certainly leads the way. And as you look towards the next one, Ellie, that'd be great. You can see 74 individuals are hospitalized today, and we've got a little bit of increase in our ICU beds, and we're looking at, there we go. We're looking into that to really determine why, and I'll report back to you next week. Are these major medical emergencies that we're seeing, or more of the COVID in ICU? We don't know. That question just came up on the previous call, and I indicated I'd look into that and try to find out what's going on there. Positivity rates at 7.2. That'll continue to decrease as we get more testing out there. It's good to see that we're over at over 24,000 tests, but we really got to ramp that up, and we hope to. And the turnaround times 1.63 days. Again, just to reiterate, San Mateo still leads the way in positive cases. Don't read anything into that. The statistics are meaningless, and if you try to extrapolate out why that is, it just doesn't work out, just doesn't pencil out. And certainly, just to reiterate, so long-term care facilities, and that's why we're putting so much work into that, where we've had 50 of those 76 deaths are related to the long-term care facilities. So of 81 hospitalized, we've had 50 deaths, which is a number that we certainly hate to see. Just back to, I guess, to the tests. Over 540 tests were conducted in Daly City between Wednesday and Thursday, which is great. On the good news front, the Great Plates program is just working out really well, and our folks have done such a tremendous job on that program. We're now at over 900 older adults being served by that program, and that number grows daily. And certainly they have to meet a criteria to qualify, and there's so many people that do that. We've heard of one individual who was really down to just eating ice cream before these meals were being delivered, and it's just so grateful. And not only that, it's the dual purpose of really putting restaurants back to work. We now have over 40 restaurants participating. We will look to expand that. So think of all the employees that brings back to work, and the revenue that it brings back in to those restaurants that were seriously hurting. So you can help us to spread the word. You can call the county's Aging Adult Services at 800, and Ellie, maybe you want to put that in the chat later on, 800-675-8437. Just some general information as we head into the long weekend. We're reminding people to recreate their responsibility and abide by the face coverings and social distancing. In regard to, I've seen some articles about the Half Moon Bay parking lots. Those parking lot openings will be entirely up to the cities. They can open those parking lots at any time that they choose. It is in the order that they may close the parking lots, which indicate they may also open those parking lots. So it's entirely up to them whether they want to open the parking lots or keep them closed out on the coast. We do ask them to certainly the extent possible, anyone using the beach this weekend, this Memorial Day weekend, to maintain social distancing. And obviously, those other provisions are still in effect with coolers and no coolers, no umbrellas, no chairs, I believe, and other things that that are required that are in the order that you cannot bring to the beach. Certainly, you can walk, jog, run, bring your dog, sit in the sand, but we're hoping that people who have gone this far will not let their guard down at this stage of the game. We still have a long ways to go to bring this all the way home. So we're just making sure that people are aware of that there's still social distancing orders in place and requirements that you can't bring those things to the beach. Let's see what else. The county clerk recorder announced yesterday that the marriage license applications and wedding ceremonies are now available through video conferencing. So isn't that nice that I think that's terrific. So marriage license applications and wedding ceremonies can be are now made available remotely. Yesterday, we also shared the news that the state awarded the county $750,000 to support our efforts to protect and house the homeless through Project Room Key. We're very grateful to the state for that. It's costing us about $1.5 million a month to house the homeless in the hotels. And talking about hotels, just a quick update on those. We've got 91 clients sheltered at the Bayfront Station. So 75 rooms total, so we're just about at capacity there, and we've got about 175 in the homeless in our hotels throughout the county here. So with that, I will go ahead and open it up to any questions you might have.
So just a reminder, you can press the participant icon at the bottom of your screen, and a window will pop up where you'll see a raise hand button there if you'd like to ask a question verbally. And you can also submit questions through the chat box. Please just remember to let us know where you're calling in from. And I see Henrietta Burrows, you've been unmuted.
Henrietta, I got to say, I always look forward to your questions.
Thank you so much. I very much appreciate your receptivity. A simple one for you. How long will the testing sites be open? Is there a limit, for example? Someone said only next weekend, last weekend in May for East Palo Alto. Is this true? I thought they were open indefinitely.
Well, yeah, thanks for that question. Actually, that question just came up on the elected officials call too. The short answer is we don't know how long they'll be here. We think they're here for the long haul. We just applied to the state to expand testing into North Fair Oaks and out on the coast in Pescadero and Half Moon Bay area. So we do not have any information like that they're going to be just here through the end of the month. Our information is to the contrary, that they will be here longer. How much longer, we have no idea, but the state is ramping up testing. And this is a state-run operation through Verily. So we're looking to expand it, not shut it down at this point in time.
Thank you.
Great. And I don't see any other questions. So just a reminder, if you'd like to ask a question, you can press the raise your hand button. Oh, here we go.
And also just want to let everyone know that we've got David Silverman on the phone too. So if there's any questions about the order themselves, this is a great time to ask. And we also certainly have Peter from Health on the line too. So if there's any health questions, we're happy to answer those.
So we have a question from Zachary Clark. What about parking lots at state beaches on the coast? When will they reopen, and what beach bathrooms? And what about beach bathrooms? When will they reopen? And then also asking about beach closures between 11 to 5. When might that restriction be lifted, and what's the reasoning behind it? There seems to be a lot of confusion about that restriction.
Yeah, it's a good question. Really, it's about allowing access to the beach. The beach is not owned by those who just live by the beach. Obviously, it's a state resource. And we realize that people, for whatever reasons, are drawn to the beach. But we wanted to give an opportunity for those who maybe live away from the beach to access the beach during specific hours, but not during the most crowded hours of the day. And so it will allow for more social distancing, and you know, we obviously recognize that that is hard to enforce. And we simply emulated orders already in place, I believe in Sonoma and David someplace else that I can't remember. Where else? Do you remember?
Santa Cruz.
Santa Cruz, yeah. So those orders are standing there. They seem to be working for those agencies. And you know, and again, you know, we did this at the request of those cities who were inundated with people coming to their smaller cities and parking all over the place and not socially distancing themselves and going into markets and really impacting the food supply chain in those markets. So to the extent that they came to us and said, hey, we don't want any restrictions, that's terrific. As far as the state, they can follow suit anytime they want. I mean, this was the way the orders were written, and correct me if I'm wrong, David, it was a may close the parking lots. It wasn't a shall close the parking lots. It was a may, so they could do that at any given time and reopen them at any given time that they felt the necessity to do so. To the extent that they're now, they can open them tomorrow if they would. But it's their prerogative. David, did I miss anything there?
No, I mean, under the current order, it is up to the owners of the parking lots to decide whether they're open or closed. Now, the folks who manage an area have an obligation to actually monitor and manage it to ensure as best they can that the order is being complied with. But if they believe they can manage their areas and open the parking lots, that's completely within their discretion.
Great.
I don't see any other questions, so just a reminder, you can submit through chat or press the raise hand button.
Okay, nothing. Great. Listen, everyone have a great and safe Memorial Day weekend. Hopefully get out and relax a little bit, and we will be back next Wednesday. Take care.